You got a hole in your nose, the size of a quarter, sweetheart. It is not a pretty sight. Nor are you. You look like weak old dog shit.
You know what, Christian? People.
Well, that's not a very nice thing to say to your ex-wife.
Good to see you.
No, cut the crap, Christian. I know why you wanted to see me. You invited me to lunch so you could sweet talk me and keep my mouth shut at your custody deposition. That'll never happen. I've been transitioning into acting. So rewarding to do more than stand there and pose. Now I get to stand there and speak.
So I'm not a regular watcher of Nip Tuck, but it looks like the two of them were married. They've got a custody battle, and Christian, the plastic surgeon, wants her help so that he can get the custody that he wants. Now his ex-wife is going from modeling into acting.
Look, I want to know what it's going to take to get you on my side.
A goddamn miracle for starters.
I can't lose Wilbur, Kimber. I love him too much.
Excuse me.
Don't you wish you were way less famous from this moment you're faded?
Well, this has gone downhill really quickly. So not only do they have a bad relationship, but she's on drugs and she's doing some cocaine in the freaking bathroom. Now, I'm so anal retentive that just the thought of taking your bag and dumping all of it on the floor of a bathroom stall, that gives me the heebie-jeebies.
What took you so long? Your straw get clogged?
The whole world isn't on your time clock, Christian. There was a line in the ladies' room.
Several, I'm sure.
FYI, I met some movie producers who think I'm the bomb, and they can't wait to get into the Kimber Henry business.
Jesus, Kimber.
So you can take your holier-than-thou bullshit and shove it up your ass, Christian. Decided to testify against you. You're gonna go down once and for all. Oh my God. What's going on? Oh my God. Oh my God.
Her nose is bleeding, and I guess they want to imply that this is due to her cocaine snorting. The interesting thing here is that that's the exact opposite of what I would think would happen if you snort cocaine. Now, we actually use cocaine when we do nose jobs all the time, believe it or not. We take liquid cocaine, we put it on cotton balls, and we put it actually in noses. And that cocaine actually will constrict the blood vessels to reduce bleeding during a nose job. So yes, if you've had a nose job before, you may have actually had cocaine used on you. Well, bleeding is kind of the opposite of this. So I don't think that this is all that realistic.
It's a good thing you had these in your purse.
I think he just pulled tampons out of her nose, which actually is kind of a smart thing. I mean, I guess if you could stuff them in your nostrils and you've got a bloody nose, then that's not a bad idea.
Tilt your head back. Congratulations, Kimber. Your little coke jack has hollowed out your septum and eaten a good deal of your nasal cartilage.
So there is some truth to this. If you do too much cocaine, you can constrict once again those blood vessels on the inside. And if those blood vessels are constricted chronically, then you can reduce the blood supply to the nasal septum, which is the cartilage that separates the two nasal airways. And if that's done for a long enough time, you can actually kill off part of that cartilage and get a hole in the cartilage. I've actually seen patients where they look normal on the outside, but when you look on the inside, there's a huge hole in their septum where you can see from one nasal airway all the way across to the other.
Speak English.
You got a hole in your nose, the size of a quarter, sweetheart. It is not a pretty sight. Nor are you. You look like weak old dog shit.
You know what, Christian? People.
Well, that's not a very nice thing to say to your ex-wife. Well, taking that out of the equation, so she's got a hole, he says, the size of a quarter in her nasal septum. So that can create some major problems to the actual structure of your nose. There are certain celebrities who've actually had this happen to them, where they have done so much drugs that the septum, the cartilage, once again separating the two nasal airways, becomes disintegrated and the nose collapses.
Models are dinosaurs at 25. Well, I'm an actress. The older I get, the more interesting I get. Sharon Stone was 32 before she hit it big.
Sharon Stone also had a nose. The sound of wind whistling through her bombed-out nasal passages didn't distract the fans.
And there's more truth here. When you've got a hole in your septum, sometimes it can create a whistling sound. That's not nearly as bad as your nose collapsing, but still could be a major issue. This episode is brought to you by my skincare line, Youn Beauty. Our products combine natural and organic ingredients with the latest in scientifically proven anti-aging components like vitamin C and retinol. So if you're looking for healthy and youthful skin without the unnecessary chemicals, this is the skincare line for you. Check them out at dryounonline.com and use the coupon code 20OFF to get $20 off your first order over $99. We'll put a link in the caption below. All right, back to the video.
What am I supposed to do? I have no money. I have no insurance. I'm screwed.
Then today's your lucky day, sweetheart. Prince Charming is right here and offering the deal of a lifetime. I'll rebuild your septum gratis. And you told Gina you won't take the stand. We'll both get our dreams.
Well, that's a pretty interesting deal. I wonder if they're going to get that in writing.
The perfect 10 looks like 10 miles of bad road. What happened to her?
Time hasn't been good to Kimber. Neither was I.
In order to reconstruct the nasal septum, you need to take cartilage from a different part of the body. And typically, one good place to take cartilage from is the back of the ear. So we have something called the conchal bowl, and that's the round portion of the ear cartilage. And it's a very common area and a very easy area for us to harvest cartilage. So we can take cartilage by making an incision behind the ear. We peel the skin back, remove that conchal cartilage, and then we cut that into the right shape, and that can be used as a cartilage graft. Now next he's making an incision inside the actual septum, which case you want to create a pocket to put that cartilage in. Now the important thing is you can't just, let's say, stitch cartilage on top of the mucosa, which is the covering, the mucus lining of the nose. You have to have tissue on both sides of the cartilage to allow it to heal and for blood supply to come in so that the cartilage doesn't basically just die off or get infected and kind of disintegrate away. And in order to do that, it's more than just making a little incision because there's a big open area there. You have to take the mucosa from other parts of the nose, inside the nose, and basically bring it down to cover that new septal cartilage. And that way it will heal into place. This can be quite an involved operation and is one that really should be done by subspecialists in rhinoplasty surgery. Now, we do consider rhinoplasty and septoplasty surgery, basically nose job surgery, as being one of the most difficult cosmetic plastic surgeries that we perform. Because studies do show that being just a millimeter off cosmetically in the nose can be visualized. You can see it from a normal speaking distance. So because of this, if you're going to consider getting a nose job, whether it's a septoplasty or rhinoplasty, you want to be very, very careful to choose the right doctor for you. What happened to the anesthesiologist and the nurse? She's under a general anesthesia and the surgeon's there by himself and then walks out leaving her alone? What kind of show is this? Oh, that's right. It's Nip Tuck. It makes absolutely no sense. Well, that was an interesting episode of Nip Tuck. Well, there was another one that I reacted to not that long ago where a guy wanted to get rid of his nipples to become a Ken doll. Take a peek at it right up here, because that one will rock your world. Don't forget to subscribe to my channel and remember to eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.